Welcome to Module 3, the last module of the Awareness and Training HIPAA series. Module 1 covered the HIPAA privacy rule. Module 2 covered the HIPAA security rule. In this module, we'll cover a few varied HIPAA topics that remain. In this module, we will cover the HITECH Act and the HIPAA enforcement rule, breach notification, penalties for noncompliance, and social media. The HIPAA enforcement rule has gone through many iterations since it was first introduced in 2003. The most recent amendment was signed into law in 2009. The purpose of the enforcement rule is to provide the agency responsible with HIPAA oversight, Health and Human Services, Office of Civil Rights, adequate authority to investigate and penalize organizations in the healthcare industry that do not comply with the rules. The four main changes relating to HIPAA privacy and security are: privacy, security requirements, and penalties are now the same for covered entities and business associates who access or handle PHI. HITECH establishes mandatory reporting requirements relating to privacy and security breaches. We will discuss these more in depth in the next slide. HITECH establishes new penalties and enforcement methods. And finally, HITECH mandated that security and privacy requirements must be detailed in the business associate contracts. Following a breach of unsecured PHI, organizations are required to report the breach to various entities. The individual whose information was lost must be notified in written format by first-class mail, unless the individual has agreed to be notified via email. Individuals must be notified within 60 days of breach detection. If the breach affects more than 500 people, organizations must notify prominent media outlets that service the area. In addition to notifying the individuals in the press, organizations must notify Health and Human Services Secretary by visiting the HHS website and submitting a breach report form. Business associates must also notify their representative partners within 60 days of any breach that occurs. The HITECH Act also introduced significant increases to the penalties incurred by organizations who violate the privacy and security requirements. Monetary penalties are applied on a four-tiered structure that increases the penalty to correspond with the culpability level of the organization that had the violation. Four levels of culpability are: unknowing. The covered entity or business associate did not know or reasonably should not have known of the violation. Reasonable cause. The covered entity or business associate knew, or by exercising reasonable diligence would have known, that the act or omission was a violation, but the covered entity or business associate did not act with willful neglect. Willful neglect corrected. The violation was the result of conscious, intentional failure or reckless indifference to fulfill the obligation to comply with HIPAA. However, the covered entity or business associate corrected the violation within 30 days of discovery. Willful neglect uncorrected. The violation was the result of conscious, intentional failure or reckless indifference to fulfill the obligation to comply with HIPAA, and the covered entity or business associate did not correct the violation within 30 days of discovery. The corresponding penalties per violation are: did not know, $100 to $50,000; reasonable cause, $1,000 to $50,000; willful neglect corrected, $10,000 to $50,000; and willful neglect uncorrected is a minimum $50,000 fine. The maximum penalty amount was also increased to $1.5 million for identical violations within a calendar year. These penalties apply equally to covered entities and business associates. Employees of healthcare organizations must be vigilant to never post patient data to public sites or personal accounts like Facebook, Twitter, or personal email. Some examples of this that have been investigated by Health and Human Services are: a nurse who posted a patient's picture and chart to Facebook, along with comments on her sexual health concerns. ER personnel posted pictures on a web of a man dying from stab wounds. A physician in Oklahoma treating a patient via Twitter. This concludes the presentation phase of the HIPAA employee training. After successfully completing the last quiz, you will receive notification of training completion via email. Thank you.